The air we breathe, once a source of life, is quietly stealing it away. Air pollution is a global health crisis of staggering proportions. In 2021 alone, it claimed an estimated 8.1 million lives, a grim statistic that rivals the death toll of smoking. Even more heartbreaking is the impact on the most vulnerable among us. 700,000 children under the age of 5 lost their lives to this invisible killer. These numbers are not just statistics. They represent mothers and fathers, sons and daughters, whose lives were cut short by a preventable tragedy. The World Health Organization estimates that 99% of the global population breathes air exceeding its recommended guidelines for clean air. This means that nearly every corner of our planet, from bustling megacities to remote villages, is affected by this silent epidemic. While the sources and severity of air pollution vary, the consequences remain tragically consistent: diminished health, shortened lifespans, and a world struggling to breathe. Air pollution is a complex mixture of harmful substances, but some of the most dangerous culprits include particulate matter 2.5, nitrogen dioxide, and ozone. PM2.5 consists of tiny particles smaller than the width of a human hair that can penetrate deep into our lungs and even enter our bloodstream. These particles come from sources like vehicle exhaust, industrial emissions, and wildfires. Nitrogen dioxide, a reddish-brown gas with a pungent odor, is primarily released from burning fossil fuels, particularly from vehicles and power plants. Ozone, a colorless gas, forms in the atmosphere through reactions between sunlight, nitrogen oxides, and volatile organic compounds. These pollutants don't just hang in the air, they infiltrate our bodies, triggering a cascade of negative health effects. The smaller the particles, the more dangerous they are, as they can bypass our body's natural defenses and wreak havoc on our organs. Exposure to these pollutants has been linked to a wide range of health problems, including respiratory and cardiovascular diseases, cancer, and even cognitive decline. Our respiratory system, the intricate network responsible for delivering life-giving oxygen to our bodies, bears the brunt of air pollution's assault. PM2.5 in particular is notorious for its ability to irritate and inflame the airways, leading to a host of respiratory problems. Studies have shown a direct correlation between PM2.5 levels and increased hospital admissions for respiratory illnesses, such as asthma, bronchitis, and pneumonia. In fact, the World Health Organization estimates that air pollution contributes to nearly 4 million premature deaths from respiratory diseases annually. Children are particularly vulnerable to the effects of air pollution on their respiratory health. Their lungs are still developing and they breathe at a faster rate than adults, meaning they inhale a greater volume of air and pollutants relative to their body size. Exposure to air pollution during childhood has been linked to an increased risk of developing asthma, reduced lung function, and an increased susceptibility to respiratory infections. While the impact of air pollution on respiratory health is well established, its insidious effects extend far beyond our lungs. Emerging research has revealed a disturbing link between air pollution and cardiovascular disease, the leading cause of death worldwide. PM2.5 has been shown to contribute to the hardening of the arteries, a condition known as atherosclerosis, which can lead to heart attacks and strokes. Studies have also linked long-term exposure to air pollution with an increased risk of developing heart failure. More recently, scientists have begun to unravel the alarming connection between air pollution and neurological health. Studies have shown that exposure to air pollution, particularly during critical periods of brain development in childhood, can have detrimental effects on cognitive function, memory, and attention span. Some studies have even linked air pollution to an increased risk of developing neurodegenerative diseases such as Alzheimer's and Parkinson's later in life. The fight against air pollution is not just about protecting our environment, it's about safeguarding our health and ensuring a just and equitable future for all. The fight against air pollution is not just about protecting our environment, it's about safeguarding our health and ensuring a just and equitable future for all. The stark reality is that the burden of air pollution is not shared equally. Vulnerable populations, including children, the elderly, low-income communities, and those living near major sources of pollution, bear a disproportionate share of the health consequences. Addressing these inequalities is paramount to achieving environmental justice. The good news is that we have the power to create change, transitioning to cleaner sources of energy, promoting sustainable transportation options, improving industrial emissions standards, and investing in green spaces are all crucial steps in the right direction. As individuals, we can choose to walk, cycle, or use public transportation whenever possible, reduce our energy consumption at home, and support policies that prioritize clean air and a healthy environment. The fight against air pollution is a collective effort, one that requires a unified front from governments, industries, communities, and individuals alike. By working together, we can clear the air we breathe and create a healthier, more just, and more sustainable future for generations to come.